West Suburban Medical Center is a for-profit community hospital based in Oak Park, Illinois. Having opened its doors in 1914, the 234-bed hospital has been serving the west side of Chicago and its neighboring communities for well over 100 years. This is something that the staff at West Suburban take great pride in, as the surrounding hospitals such as Loretto, a nonprofit hospital that is less than 5 minutes away from West Suburban, is, for the most part, incomparable to what West Suburban has become. Loretto originally opened its doors in 1939 and has approximately 600 employees, compared to West Suburban Medical Center's 2,300 employees. This stark difference is due to the number of specialties and community members that West Suburban caters to. That is not counting the surprisingly large internal medicine and family practice residency programs, something that attracts doctors and doctors-to-be nationally. With 24 different specialties in their docket, there's a lot to choose from in terms of care options. I've listed them on the screen here just to emphasize the magnitude in which this seemingly small community hospital is caring for their surrounding population, widely on an outpatient basis, by the way. Having recently been acquired by Pipeline, a massive corporation based in California, West Suburban Medical Center has been expanding and highlighting certain departments, per their administrative guidelines and goals. Interning in the C-suite myself amongst the directors of case management, the newly expanded subacute rehabilitation unit, and other directors, I see those goals and the pressure that is brought on to meet them by both stakeholders and physicians. This makes sense, as their bonuses can be directly affected by the performance of these units, and the hospitals stride towards different goals. As mentioned, the Subacute Rehabilitation Unit, or SARS unit, was recently expanded to accommodate more patients. The hospital has been working in partnership with their sister hospital, Weiss, to emphasize these new services, as the SARS unit is located on the hospital campus, though it is a separate business entity altogether. Cost is a huge factor in this decision, as well as many others, as it can impact both hospital and payer performance. Something I learned about very quickly once I transferred into the case management department after completing about 2 months of rotations in the ICU with its social work director, Ellen Walker. Being exposed to both administrative and clinical functions was very eye-opening for me, especially as I went from allocating free resources to patients and their families to directly working on shadowing and facilitating projects that affected avoidable days and ultimately the hospital's revenue cycle. As I put together discharge plans and spoke with families, I quickly realized that the social work and case management departments were more closely tied than I had imagined, and this was a game changer for me. According to their hospital report card, a tool that was recently updated for the year 2019, West Suburban Medical Center's data can really speak for itself in terms of utilization prior to the COVID-19 pandemic. We are allowed to see both length of stay, median charges assessed to payers, and a variety of statistics related to public health utilization. While West Suburban Medical Center is not obligated to provide their community health needs assessment on their website to the public, we know from prior discussion that Loretto Hospital is less than 5 minutes away from West Suburban, meaning the figures concerning the population served are almost identical. I used this data in my own research for the hospital, and I thought it was worth mentioning because of its alignment with utilization, especially as I assisted in creating a list of recommended areas to invest in for the hospital. Something I didn't expect to see on West Suburban Medical Center's website was an approximate charge master of all of their services provided. With over 5,000 rows of services, I was absolutely amazed to see this available to the public, something that many institutions seemingly hide from the public. As mentioned previously, I would primarily work in the case management department. Case management departments are ultimately existing within the hospital to improve and refine clinical and payer practices and, of course, length of stay. Without case management, there would be a lack of emphasis on avoidable days, documentation, and therefore payment to physicians and facilities. Revenue cycle is not only essential to a hospital's delivery of services, but without it improving over time, hospitals would not be able to meet their forever growing demand for services. Employees would not be reimbursed for their work, insurance companies and governmental agencies would not pay the hospital, and there would not be sufficient grounds to provide charity work to surrounding communities, let alone be financially stable as a whole. Having started interning at West Suburban in mid-December of 2020 to now, nearly the end of April of 2021, I've spoken to many people of different backgrounds and titles about cases, policies, life, and their impressions of the hospital during their time there. I believe that the diversity at West Suburban and willingness to consult those outside of its facilities has only strengthened the organization as a whole. While I feel that there is a disconnect and a sense of frustration between practitioners and administration due to COVID-19 guidelines, I feel that there's also a disconnect between those who have been admitted to the hospital. I also feel a sense of guilt for the staff members. It's clear that the staff would like to give the patients the autonomy that they deserve, but the hospital is at capacity, and CDC restrictions mean no visitors unless your loved one is dead or dying. Trust me when I say that this has had a huge impact on plan of care meetings where a family dropped off their loved ones with minor symptoms and came back deciding whether they were to be on hospice days later. Though this wasn't unheard of before the pandemic, the prevalence of it has created tension during rounds and ultimately a disconnect between patients' families and staff, both of whom should be with the family in their time of need, but only one could actually be there. Beyond the experiences and therefore knowledge gained at West Suburban Medical Center, I also gained skills within the industry, writing discharge plans, doing research to support future policy practices, and speaking to patients and families about their rights were all tasks that I took part in on a regular basis. I've always been interested in legal aspects and regulatory needs that healthcare relies on, and as I navigated through this internship, I was exposed to the depths of which policy reaches. It is one of my goals to develop policy to reach underserved communities and populations. I got to know resources in which people can advocate for their loved ones, themselves, and eventually members of their community. It's been a goal of mine for the future, and one that I think has been rooted even further by taking time to assist in placing patients in different facilities. An example of a case I can only imagine myself remembering for a very long time is when I worked to place a homeless man at a specialized hospital in which he would not only receive financial and housing assistance, but an individualized long-term psychiatric plan. I spent about 2 hours making calls to a variety of hospitals, shelters, and just doing research online. Time is extremely valuable in social work, especially when the community hospital you're working at only has 4 social workers, and you're meant to make rounds on the entire hospital that's full of patients. Exposure to this definitely pushed me further into public health and policy, something I have no regrets in pursuing now, especially with my dual master's degree beginning in fall in public health and business administration. Over the course of the internship, I learned more about organizational structure, payer compliance, and the issues that the hospital faced prior to and now through the COVID-19 pandemic. I gained the connections I desired, and I worked on projects such as researching social work best practices, securing modes to discharge patients, and facilities to transfer them to. I delivered Medicare important messages, learned about insurance and payer regulations, and disputing denials. I learned about organizational structure and how a seemingly vertical structure inevitably overlaps and is interconnected. Having not worked for a for-profit healthcare institution in the past, I learned about the differences between the two. Analyzing data and drawing conclusions independently was something I hadn't done outside of this internship and outside of academia in general, especially in the context of policy, which is exactly what I want to do in the future on an administrative level. I believe this internship has been extremely helpful and impactful for more reasons than one. I've built connections on not only the work that I've produced, but discussions that I've had with people. I see that I communicate differently now than prior to this internship, as I now see context and perspective as the foundation of discussion and debates. Previously, I may have looked at this difference on a surface level and made conclusions before understanding the person or concept at hand. I did not walk into this internship with a scope of expectations and a bucket list to cross off, one by one. I had intentions to network and market myself to an organization that I could potentially gain experience, connections, and employment from in the future. With that being said, I'm now walking away from this internship feeling more secure in my academic and career goals, something that I can only thank my preceptors that I've worked with for. West Suburban Medical Center, like many others, has a timeline in which they hope to grow along. As unpredictable as this year and a half has been, I think that everyone has grown in one way or another. We have seen the healthcare sector change, and we have only become more prepared for the future ourselves. I think that with time, we will all gain the experience we need to be successful, and this internship has been no different than that.